Next question. The schedule which provide standard for ophthalmic preparation. Options are Schedule P, Schedule R, Schedule FF and Schedule Y. The right answer is Schedule FF. Schedule FF provides the standards for ophthalmic preparations. Schedule P describes the life period of drugs in month. Schedule R contains regulations for condoms and other mechanical contraceptives. Schedule Y is about clinical trials. We will discuss all about these different schedules and tips to memorize them in another video. Next question. Citric acid cycle takes place in. Options are liver, mitochondria, endoplasmic reticulum and nucleic acid. The right answer is mitochondria. The citric acid cycle CAC is also known as TCA cycle, that is tricarboxylic acid cycle or Krebs cycle. In eukaryotic cells, the citric acid cycle occurs in the matrix of mitochondria, but in prokaryotic cells like bacteria, which lack mitochondria, the citric acid cycle occurs in cytosol. The cytosol is the liquid part of the cell. Let's discuss about some other pathways and where they are taking place. Urea cycle and gluconeogenesis take place mainly in liver and to a lesser extent in kidneys. In most organisms, the glycolysis and pentose phosphate pathway occurs in cytosol. The protein synthesis occurs in ribosomes of rough endoplasmic reticulum, whereas the synthesis of lipids, phospholipids and steroids take place in smooth endoplasmic reticulum. Next question. The pyrimidine component of RNA is. Options are adenine, guanine, thymine and uracil. The right answer is uracil. DNA and RNA constitute two types of bases, purines and pyrimidines. Pyrimidines are 6-membered rings with 2 nitrogen atoms at 1 and 3 positions, while purines are actually conjugations of pyrimidines with imidazole. Pyrimidines are of 3 types: cytosine, uracil and thymine. We can simply memorize it as CUT, C-U-T. Cytosine, uracil and thymine. The pyrimidine components of DNA are cytosine and thymine. The pyrimidine components of RNA are cytosine and uracil. We can memorize as uracil contains RA, that is RNA. The purine components of both DNA and RNA are adenine and guanine. Next question. Example for a 5-membered heterocyclic compound with 1 heteroatom is. Options are pyrimidine, furan, aziridine and phenandrine. The right answer is furan. Furan consists of a 5-membered aromatic ring with 4 carbon atoms and 1 oxygen atom. Furan 5 we can memorize like that. Pyrimidines we have already discussed. Pyrimidines are 6-membered heterocyclics with 2 nitrogen atoms at positions 1 and 3. Aziridines are 3-membered cyclic amines. They are actually a triangle shape. Phenandrine is a tricyclic aromatic hydrocarbon obtained from coal tar. It is used in manufacture of dyes, pharmaceuticals and explosives. It is isomeric with anthracene. Phenandrine is having 3 cycles. It is tricyclic. Next question. 1 tablespoonful is. Options are 4 ml, 6 ml, 8 ml and 15 ml. The right answer is 15 ml. 1 teaspoonful is 5 ml. 1 tablespoonful is equal to 3 teaspoonful. So, 1 tablespoonful is 15 ml. Next question. Bence-Jones proteins found in urine occur in. Options are liver diseases, diabetes mellitus, multiple myeloma and thalassemia? The right answer is multiple myeloma. The Bence-Jones protein urine test is used to diagnose multiple myeloma, a type of cancer that affects plasma cells of bone marrow. Let's discuss some other important indications of urine analysis. A high number of WBCs in urine indicates an infection, possibly a UTI. The bilirubin in urine indicates a possible liver disease or blood disorder thalassemia. Too much glucose in urine or ketones in urine indicates uncontrolled diabetes. Next question. Preparations of digitalis is used in the treatment of options: hypertension, gout, myocardial infarction, congestive heart failure. The right answer is congestive heart failure. Digitalis, commonly called as foxglove, is a source of cardiac glycosides, mainly digoxin. Let's discuss a little more about the terms congestive heart failure and myocardial infarction. Myocardial infarction is a medical term for heart attack, which means that tissues in heart are not getting sufficient oxygen supply. Heart failure is when your heart can't effectively pump enough blood to meet the needs of your body. The kidney thus have less fluid output, and the extra fluid in the circulation produces congestion in lungs, liver, and body parts, and for this reason, doctors call this congestive heart failure. We can have more discussion about heart diseases in another video.